Hello and welcome to my self-massage series. Currently, I am unable to provide therapeutic massage to my clients because of this stay-at-home order due to the COVID-19 pandemic. But I still want to help out as much as possible and do whatever I can remotely. So I have compiled a list of the top complaints that I hear from my clients in my office and have developed some self-treatment routine that you can do at home. Today we are going to be talking about headaches. I see so many clients with headaches, and I'm going to show you some stuff that you can do at home to help relieve you of that pain. Let's get started. Now, this is not mandatory, but if you happen to have some lavender essential oil, go ahead and take a couple drops and put it on your wrist. This is what I do before I start every massage, as long as, of course, my clients like lavender. Lavender is just very relaxing. It helps kind of set the mood. For me, it just reminds me of being in my massage room. We're going to basically be practicing some neuromuscular therapy today. We're looking at relieving your pain by working specific muscles. So the most common headaches that I see in my office are headaches that originate on the side of the head, also right in the center, and then also in the back of the head. To address the headache that is kind of like this migraine arc headache you'll feel in this area, we're going to self-treat the SCM, which is also known as the sternocleidomastoid. So you can see this muscle. If you turn to the right, you can see your left SCM. So in order to treat the SCM, you are going to turn your head to the opposite side that you're treating, just so you can get the SCM to stick out. You're going to just grab it without pinching too hard, just so you know where it is located, and then you're going to put your head back into neutral position. You may even turn slightly towards the side that you're working on. You're just going to gently massage, taking your finger and your thumb and working back and forth. And you're just going to feel for some painful areas. And when you do find a painful area, just hang on to it. And if at any point your headache is coming back and you feel like that sharp pain in your eye or around your ear, just hold on to that point. Do not apply more pressure, just hold it until you feel that pain kind of go away. Most likely there's a trigger point in there that needs to be released, and you do that by just applying gentle pressure until it does go away. And sometimes you have to repeat that a few times. You can also then cross fiber friction. Likewise, you follow it all the way down to your sternum, and you can do some cross fiber friction there as well, and along the clavicle. You want to stretch it, and that will help to restore its normal muscular function. So this muscle turns your head to the opposite side. That's why it pushes out when you turn. And so in order to stretch it, you want to actually turn towards the side you're treating, which is kind of counterintuitive. You think, well, if it hurts on this side and I stretch it, I need to stretch away from it. And sometimes that's true. It depends on the action of the muscle. But for this muscle, we're going to turn towards the side, and then we're going to extend our head back. And you'll feel a nice stretch behind your ear all the way down into your sternum and clavicle. Be sure to take deep breaths as you are stretching it. Maybe 3 deep breaths and see. And the point of stretching is for it to release. So if you're stretching it and you feel like it's still at a stretch, you may be stretching it a little bit too far. So I just want you to go to the point that you feel the stretch, hold it for a couple of breaths, and then come back into neutral and do it again. And you want to repeat that about 3 times. So that's the basic treatment for the SCM. Moving on, another very common area of tension that is causing headaches is in your trapezius muscle. The main area that you can grab is right on your shoulder here, and mainly close to your neck. So in order to start the self-treatment for the trapezius, we do want to warm up this muscle a little bit. It is a large muscle, and all you have to do is just grab your shoulder and just gently knead. Just kind of press down and then pull. Press down and pull. Press down and pull. Press down and pull. And you can do that all the way up to the side of your neck. We're just warming up the tissue. Now, to treat the trigger point that most often causes headaches We're going to do the same technique as the SCM. Now for this muscle, the trigger point is usually right here where your neck and your shoulder meet. And just kind of sift through the muscle. I want you to really feel for the area that is most tender. So you want to hold it. Take a few deep breaths until you feel that release. You want to do the same thing as SCM, and after you work the muscle, you want to stretch it because this just reminds the muscle of what it's able to do. It reminds it to go back to its normal length, which will allow it to have its normal functioning. So this muscle has a lot of action, but we're going to focus on is the lateral flexion aspect. So we're going to keep our shoulder blade down. So if we're working the left side, I want you to press your hand down. You're going to take your right hand up and over to the left side of your head. Then you're going to gently laterally flex to the right. Now, in this position, you can also stretch out the levator scapula, which is a hard muscle to self-treat. That's why you really should find a qualified therapist, once we get through this pandemic and we're actually able to receive massage therapy, to treat these specific muscles. But these are just things that you can easily get to that can help you through this time. So to stretch the levator scapula, you're doing the same thing, flexing to the right, but then you're actually going to turn your nose to your armpit, and then you'll feel the stretch more along the back side of your neck and shoulder, right in here. I would do it about 3 times. I would do each stretch about 3 times. I would do each muscle technique about 3 times as well. Another common area people experience pain is in the back of their head. Now, there are these tiny little muscles that are in the suboccipital space of your head, which I do not suggest you digging into right now. That is something you really want to see a qualified practitioner for. However, there are muscles that you can palpate that I think would be really effective for you to treat those back of the head pains. So to treat the semispinalis muscle that causes headaches in the back of the head here, I want you to just first warm up the tissue. So you're just going to take a broad contact with the back of your neck and just kind of squeeze and pull the skin. Try to pull the skin away from the muscle. You can also just do some circular motions to warm it up, and then you'll be ready for the specific work. So we're going to treat the left side here. So this muscle extends your head. So you can do that a little bit just to make it pop out, and then relax it back to neutral. And then just like the SCM, you can just massage, basically rolling the muscle between your thumb and your finger, and it goes all the way down. And if you get to a point where you are experiencing the pain in the back of your head, or just a spot that's really tender, just hang out there for a second. Explore the muscle and see where the most tender point is, and then find it and hang out there. And I would repeat that again 3 times. Now what we want to do to stretch this muscle is just do the opposite of its action. So it does extend, and this muscle rotates to the opposite side. So to then stretch it, you want to rotate to the same side and then flex. You can feel a nice stretch right along here. And again, just go to the point that you feel the stretch. Do not overstretch it, okay? I want to go over the muscles that do lie over your head. The temporalis muscle can sometimes feel like a vice grip against your head, and you feel a lot of tension right here. It can also cause some jaw pain. So to treat that muscle, what we're going to do is just have your finger pads, put your middle 3 finger pads, just right over your temples. And just do gentle circular motions while providing a little bit of pressure. And you're just going to sift, and you're going to search for any tender spots. And if you come across a tender spot, I want you to hold it. And just like the other muscles, I want you just to let it release on its own without adding too much pressure. You can come back to it and just check in again. If it's still tender, we treat it again. We treat it up to 3 times. So if you get headaches right in the center of your forehead here, it's most likely from the frontalis muscle. It raises your eyebrows, it squints, so when you are looking at something, maybe you're looking at the computer, or you're just maybe stressed a lot, and so you're always thinking, it's kind of like a thinking muscle, that can cause headaches. There's a trigger point right in the center of your forehead. So, just like the other muscles, you can do some circular motions, we're just softening. And you're also looking for a tender spot. If you find it, again, you just hold it until it releases. And you do that a few times. Then, to stretch this muscle, position your hands like this in the center of your head and just spread it apart. And again, you can do that a few times too, and that really will stretch it out. Now, do some face stretches. And that will help loosen that up as well. So let's recap the main technique here. So the first thing that you want to do is just warm up the tissue. Get some blood flowing, go in there and just loosen it up so it'll be more accepting of the massage work. Then we specifically treat the muscle by applying gentle pressure or massaging between our fingers and our thumbs. Then you want to stretch the muscle to restore its normal function. You're reminding the muscle of how long it's supposed to be, because the muscle does over time shorten. If like your shoulder is always like this, that muscle will shorten. So once we work the muscle out and like relieve the tension, then we want to stretch it out to restore that normal function. Also, what's very important, even just doing this short little session, is to hydrate. It's very important to hydrate after any massage. There are two things that I really like using to just help me with any pain that I have, whether it's a headache or neck pain. The first is my favorite roll-on from Young Living, the Deep Relief Roll-On. And this has peppermint, wintergreen, copaiba. And what I like to do with it, first, it's a roll-on, which I love, so I don't have to actually touch the oil, because if you put peppermint on your finger and then touch your eye, you're gonna have a problem. But when I'm having headaches, I can just roll onto my temples and across my forehead. Also on my neck, I like to apply it just along that semispinalis muscle and then down my spine. And sometimes if I can reach down between my shoulder blades, I'll get there as well. But this is a lifesaver. I love this one. Now this is something that I've just recently been using. I've been using the Deep Relief forever, but this one I've only been using for about a month. And it's a CBD oil infused muscle rub. And so for this, it's just like a balm, and you need barely any. Oops. This is all I have on my finger, just a teeny tiny bit. And how you apply that is just massaging it right on the area. And you can do your research to find out all the health benefits of CBD oil. So it's just very easy to apply. So I will leave links in the description box if you're interested in any of those products, and then also any other resources that I can find that may help you. And I really hope that you enjoyed this video. I hope it was helpful. I hope it was informative, and I look forward to the next one that we do. So if you're interested in learning more information about how you can self-treat at home right now, please subscribe to my channel. I hope you have a great day. Please take care, and I will see you soon.